PAR PT's cancellation policy includes, for the evaluation, we make sure that each person knows that it is non-refundable, just because we do take a lot more time in the beginning to get everything prepped up. And we want to make sure that everyone's ready for the evaluation when it's their turn. As far as their treatments, we just ask 24 hours notice prior to the visit to avoid any cancellation fees. And the cancellation fee is essentially half of what the fee is for that appointment. At PAR PT, we do treat pediatrics ranging from 6 months old all the way to 14 years old. Myokinesthetics is a nerve and posture rebalancing technique that specifically works on not just muscle tone and fascia, but autonomic regulation. And so being able to combine that with our treatments of changing posture and changing the way our body responds to stimulus is a big part of how myokinesthetics works. At PAR PT, we truly are EDS experts. We have over 10 years experience with it, and we understand not just the condition itself, but all the other conditions associated with it, whether it's Chiari malformations, mast cell activation syndromes. We have POTS and dysautonomia, and so there's a lot that goes into it, and understanding these secondary diagnoses allows us to make a program that is much more efficient and much more progressive than traditional programs that usually end up causing more flare-ups and more pain and more autonomic issues. And so understanding how to organize those things is what separates us from everyone else. We do offer telehealth services, and this goes from both in-state and out-of-state. And how we have it for the out-of-state, we do a wellness program, which is essentially focused on stability and strength and injury prevention. Again, anyone nationally, even globally, can participate in those programs. Whereas when we do in-state telehealth services, it's a little bit more geared towards physical therapy. So there's more at-home physical therapy remedies that we can give them, in addition to the stability, strength, and injury prevention programs. People can expect from our virtuals one of two things. One is the assessment process is very similar to what we do on site. It's very detailed. We have big screens at each location that allow us to see things on a bigger scale, so we can see a lot of these biomechanical faults. We can see a lot of these compensations. In addition to us having an instructional guide before you actually sign up for the service, where it shows you how to set up your home, what lighting. And so all that it allows for more efficient evaluation, allowing us to not only provide the program, but also for self-home treatments. We do have phone consultations specific to private one-on-one with physical therapists. All of our information can be found on our website. But things that are related that you need a little bit more clarity, a little bit more detail, you can register to have a phone consultation with one of our physical therapists. What people can expect from our programs is that, one, it is very specific, so we do make it from scratch the day that they come in, but it's divided into 6 levels. And the idea behind each level, it takes about 7 to 10 days for each level, but people can go at their own pace. They can take a little bit longer. But the idea is to formulate this in smaller progressions, to where the body's slowly getting used to new stimulus, slowly developing these fundamentals that's necessary to add on to more complex movement patterns, to exercises, as well as what's going on in the brain on a day-to-day basis. We have to reintegrate the autonomic nervous system via certain movements and certain breathing exercises. So how that's formulated, we have a schedule that shows a morning routine and a afternoon routine that only takes about 6 to 7 minutes to do on a daily basis. So there's not a lot of time commitment, but very effective. It's just people have to understand it's going to take a little bit longer. It's a slower progression, but it's way more efficient than jumping into something that involves like squats and lunges for strengthening when the body's not actually prepared for it. We've looked at over the past 2 years how effective the programs are, and this is based on subjective and objective findings, and we found that 93% of individuals at least get half of their symptoms resolved within phase 1. So phase 1 is typically about 6 to 10 weeks worth of material. That's with treatment and with program. which is a very high number when you consider it's out of 200 people. Now, there's still more research that we're coming along, but to show that at least half of your symptoms, even if it's a chronic illness, are resolved within the first 6 to 10 weeks is pretty remarkable. And it's something that we're looking into doing more with phase 2 as a way to get past more of that 80 to 85%. Given that something is chronic, we understand that getting to 100% is not as realistic. I mean, it is achievable, but we want to make sure we set the guidelines of really getting higher up in percentage based on what you had previously. And, when it comes to elite athletes, the same way, if they're having multiple injuries, we want to get them back into that 80, 85%, but oftentimes most people go back to 100. What to expect with treatments? This is a little bit different because we use a lot of different techniques. We have techniques related to myokinesthetics, which is a nerve and postural rebalancing technique that helps reintegrate the body. It helps autonomic regulation. It helps with GI. And so there's a lot of things that we use there to essentially get the body to function on a day-to-day basis. In addition to a lot of the myofascial work that we have microcurrent point stimulation that helps with scarring, with headaches, with migraines. There's various treatments, but with this, because it is so different than what you typically find in most clinics, the body will react a little bit different. So there's 3 ways to look at it. After a treatment, you might feel good, no adverse effects, no fatigue or anything like that. It's just something that is normal. Then we have our second grouping where afterwards you feel good and then you get really, really tired and then you get a burst of energy and then you crash again, meaning from a fatigue standpoint, you just get really sleepy, really tired. The third one where you have an even better reaction. Everything feels great. I feel brand new. But maybe 4 to 5 hours later, you feel crashed, but now you have more aches and pains and soreness, and you might find a significant change in pain in different areas. And so all this is normal because your brain is trying to figure out what new information is coming to the brain as a way to make the changes that are necessary for, optimal recovery, optimal performance. How to prepare for one of our treatments is really coming in, making sure that you understand that these side effects could be part of it initially, at least within the first 1 to 3 sessions. Crashes aren't really typical after the first 3 sessions. But dressing in appropriate attire, making sure that you're comfortable, nothing's restricted, loose clothing, making sure you're on time. And that's the big thing for us, is that because we are a high traffic clinic, or as far as volume wise, we want to make sure that everyone gets the exact amount of time. We don't want to have to shorten anyone time based on, delays or anything like that. So I think being on time, wearing the right attire, and then really keeping up good communication with your therapist. That way everything goes smoothly. The evaluation process is, it's set for 1 hour. And so within the hour, each person gets an assessment, they get a treatment, as well as the development of the program, because we do make it from scratch. We don't use protocols or anything like that. Person comes in, we check everything from head to toe, and it really is a full body where we check posture while you stand still, posture while you move, check neurological reactions to make sure that everything in the brain is going well. We'll check reflexes, we'll check muscle tone, we'll check strength and stability, but then we'll dive in deeper and check how are your organs moving, how are the fascial restrictions in the abdomen, are they too tight, are they too loose? So as we go through this, and even diving into the vestibular system where we check more of your vision, we check your head to eye responses, those things really are what make what we decide to put on your program for the next, for the first 6 to 10 weeks. But with that, at the end, we do a myokinesthetics as a way to lightly give information to the body without overstimulating it in the beginning. That way it's better prepared, not just for the program, but for the next treatment. We recommend that each client comes in at least 4 times within the first 14 to 17 days. And the reason being is that the body has the biggest response within these first 2 weeks. It's making the changes, it's receiving new information, and it takes the brain about 14 to 17 days to even get used to some of the new stimulation. So after that, it's more flexible depending on how you feel. If you are doing twice a week, you can continue. If you want to do once a week, once every other. But ideally we want those first 2 weeks to be jam-packed so we can get the most changes. That way, when you're a quarter of the way through the program, you're better prepared for what's to come. Really what makes us different is that we have over 12 years of experience treating elite athletes. When I say elite athletes, it's like professional Olympic, okay, not just high school and college. But also on the other side of the spectrum where we have chronically ill, complex neurological conditions. So we know the range between high performance and like low progressive work. So for us, that allows us to make more unique programs because everyone is so different. We have to figure out where they really fall on that realm as a way to essentially make a program from scratch and figure out what it is that they need. In addition to understanding the secondary diagnosis. So a lot of times if there's a condition that's, let's just use EDS as an example, they have a secondary condition that also affects the primary, and then having that knowledge of understanding both really allows for better progressions than only understanding one condition. In addition to that, we have a low traffic, low volume clinic. So there's not a bunch of people in there. There's not a lot of distractions. And since we do see people one-on-one, it's one-on-one hands-on treatment for the whole time. There's no distractions. We're not watching people do any other exercises. The exercises are taken home how we construct it for them individually. But overall, it's just making sure that the facilities set up for success to where you get the most out of your treatments and most out of your programs. Our programs work using the 3 systems model. So I mentioned before the vestibular system, the autonomic nervous system, as well as the GI system. So how we use that, we look at everything's connected, right? The mind-body connection. So we have to figure out what is your body doing from awareness standpoint. So from spatial awareness, are you getting recurrent injuries? Is your body aware of where middle is? And so those things make a huge difference on how your body responds, even from an autonomic standpoint. Are you compensating? Are there stress responses? With that, then goes into causing GI issues. So if there's these compensation and stress responses, it's going to mess with the connectivity, what's going on in the gut. So if we can manage those 3 systems together and create something that's slower and progressive, it allows the body to accept new information with not too much stimulus, so it can actually build a foundation in preparation for like your day-to-day activities and other performance-related things. PAR PT stands for Performance and Restorative Rehab, and we specialize in conditions related to neurological conditions, complex orthopedic and chronic illnesses, as well as elite sports performance. The idea behind what we do is we believe that the small things make bigger differences. So we focus on 3 fundamental aspects of the body, which is what we call the 3 systems. And so what that means, we have the autonomic nervous system, which is, everyone knows, more like your fight or flight response type of system. And then we have your vestibular system, which is your spatial awareness, your balance. And then we have the GI system, anything more intestinal, digestive, and whatnot. So by using those systems together, it's able to change the way the body moves externally. And that's really the key to what we do, is really thinking outside the box and figuring out what fundamentals need to be done in order to achieve optimal performance.